Well, hello, friends, and welcome to another episode of Kidney Talks with the Ron and Joy Paul Kidney Center. I am your host, the Reverend Dr. Kendrick Curry of the Pennsylvania Avenue Baptist Church in Washington, D.C., and I am so grateful to have none other than Dr. Joseph Keith Melancon of the Ron and Joy Paul Kidney Center and Dr. Clive Callender of the Minority Organ Tissue Transplant Education Program, or MOTEP, with us today. And we're going to have an outstanding and dynamic talk by Dr. Melancon. He's going to talk about reversing kidney disease. This is something that is very serious in our community. In fact, in the areas around 219 and 220, we have some of the highest incidences of kidney disease in the country. So we want to talk about reversing kidney disease. And this is going to be an important topic. So tell all of your friends to jump on Facebook and pay attention, very close attention to what Dr. Melancon is going to share with us today. Welcome, Dr. Melancon, Dr. Callender. We're ready to go.
Thank you, Dr. Curry. It is a pleasure, as usual, to be here with you, and this is really one of the topics that's really near and dear to my heart because, as you well know, because you've worked with us so often on our outreach, this is exactly what the Ron and Joy Paul Kidney Center is all about. I feel like I wear two hats. I wear the hat of a transplant surgeon, but in being a part of the community, being a community activist or an activist for healthcare out there in the community, something I learned from the great Clive Callender, what we have been able to do, hopefully, is to stop people from getting kidney disease. It's kind of funny because my job is to fix kidney disease when it can't be fixed any other way but with a transplant. But we do much more good if we can actually reverse the disease that is already there. And people are sometimes surprised to learn that you can actually reverse kidney disease. Now, we've talked about this many times on this show, but like I said, this you can't talk about it enough because kidney failure is a big problem in this country, and particularly for people of color. We as Black people have 3 to 5 times the amount of kidney disease when compared to white populations. Hispanics are not that far behind us. Native Americans and then Asians. So every major ethnic group in this country has more kidney disease than white people. And primarily it boils down to our culture, what we like to eat and how we take in drinks and all kinds of things that actually affect our kidneys and our incidence of high blood pressure and diabetes. So I'm looking forward to this, and let's get started. Anyway, next slide. All right. So when you start talking about what can you do to keep your kidneys happy, even before we get to talking about dysfunction of your kidneys, is simply drink a lot of water. Now, when I say drink a lot, people thinking of they drink all kinds of things. No. I mean water. Even, right now I'm drinking this fancy water. They call it alkaline water or whatever that someone brought me from one of these high-end gyms in the DC area that probably Dr. Curry goes to. But any kind of water is good. Just the good old-fashioned water that God made, you need to drink a lot of it. And Dr. Callender has talked about this in the past, but when you sit down to dinner or any meal and you drink a couple glasses of water, you actually eat less. So drinking water is not only good because you need the water to dilute out all the toxins that's in the body and to help your kidneys stay happy and healthy, but drinking water when you eat causes you to eat less, because when you put liquids inside of your stomach, it changes the tone of the stomach in order to hold the liquid. And as the muscle tightens up to hold the liquid, then when you eat solid food, it makes you feel satiated earlier. It's one of the reasons why soups is always the first course, because if you take in liquids, then you're less likely to gorge yourself on the rest of the meal. So drinking plenty of water helps you, not only because it keeps the kidneys hydrated, but it helps you not want and desire things, more food, particularly salty things, right? Because what salt does is it pulls water into our cells. So whenever you take in salty things, you actually are kind of dehydrating your body a little bit. So what you, or at least you feel dehydrated. So drinking plenty of water is going to help you feel less dehydrated, and that's good for your body and it's good for your kidneys. Next slide. And again, I mean, we can't talk enough about healthy eating. One of the main problems that I've seen in my years of being a transplant surgeon and dealing with people with kidney disease is that they don't eat a good diet. What is a good diet? Well, number one, drinking lots of water. Number two, eating lots of fruits and vegetables in their raw form, right? I'm talking about out of a can, just going to the grocery store and buying good old fashioned raw fruits and vegetables. The more of that kind of stuff you eat, again, it's going to take up space in your stomach, and it's going to make you eat less of the stuff that you need to be eating less of, which is animal proteins, animal meats, and dairy. You want to decrease dairy. You want to decrease the red meat, all meats. You want to increase the amount of fruits and vegetables. You want to definitely try to get out of your diet fried foods and salty foods. One of the things in our culture is we take in way too much salt and sugar, and we start young. And when you start abusing these foods as a kid, it changes your taste buds and it makes you crave more of them. I will sometimes walk into our cafeteria at the hospital and watch people take the salt shaker and just, it doesn't matter what type of food they have, they're adding salt to it because those taste buds have already been programmed to desire that stuff. You can program your taste buds. I had a gentleman, I'll tell you a story just recently, who came to me, and he had lost 150 pounds without any sort of surgery. He did this naturally. And I asked him how he did it. And he said that he had this guru, doctor that he went to see. And the guru doctor kind of got him to change his diet, right? But more than anything else, because what the doctor taught him to do was to eat a lot more fruits and vegetables and get rid of salt and sugar. And so it was nothing earth-shattering, but what was really earth-shattering for him was he left his environment and went and spent time in a foreign environment for a couple of months. That was the key. Because you see, when he got out of his environment and what these sorts of things that were his normal cravings, where he would stop on his way home and pick up, his chicken wings and his salty snacks, he wasn't doing that anymore. He was over in out in California where they only eat tree bark, and he was in this new environment. Then all of a sudden, after a few weeks of doing this, he wasn't craving that junk anymore. So that was really the most important thing. And then the next thing that happened to him is, since he was feeling better and he was urinating a lot and all this fluid was coming off of his body, all this fat was melting off, he also felt like doing exercise. Nothing extravagant. People think exercise needs to be going to a gym and lifting all sorts of weights. Exercise needs to be something that you enjoy doing, like walking. Just go for a nice long walk 3 to 4 times a week. That's exercise. And you put those two things together and you make yourself healthier. Next slide. Okay, so first of all, we got to know what is normal. Particularly in my community, I'm African American. I'm from the South, the deep South, Louisiana, and sometimes down where I'm from, and Reverend Curry understands this as well. Where we grew up, we had this term that we call big bone, right? Big bone, but bones aren't any bigger in the South, right? So what we might have referred to as big bone meant that these people were overweight, obese even, right? So it's not good to be obese. Now, I get it that being a little overweight may not be unhealthy, and it really isn't. But the problem is being a little overweight tends to lead you to be a little bit more overweight, and you start going in the wrong direction. Okay. And it's not that you need to be anorexic or rail thin to be healthy, because that's not healthy either. For matter of fact, it's actually more unhealthy to be very, very small than to be a little overweight. So we understand that in medicine. But the point is, you've got to know what it means to be overweight. Now, there's a lot of controversy about what GFR is, glomerular filtration rate, based on race, and we've gotten rid of that now, or we're getting rid of it in medicine. But there is a difference, or there can be differences, even ethnic differences in body mass makeup. In other words, the more muscles you have, the more dense your body will be. And that's why your typical NFL football player is not going to be in that normal weight BMI category, because they have so much more muscle, like me here. They have so much more muscle than a normal person, like Reverend Curry. So the more muscle you have, the more dense your body will be. And so you could be healthy and have a higher BMI, but it's not really going to be higher than, say, 30. So once you get a BMI that's 30 or above, now you're talking about obese. And that's where the problems start to happen. So everyone should have a scale at their home, and you should take your weight, and you should keep notice of how much you weigh and know what that means for BMI. All you have to do is pull up your phone and put in BMI. There's a bunch of BMI calculators. If you're male or female, what's your height, what's your weight, and it will spit out what your BMI is. But like I said, when you start to get a BMI over 30, that's going to negatively impact your health. Next slide. Okay. This is very, very, very important, because one of the main reasons, actually the main reason to have kidney problems, is to be diabetic. And so when you go to the doctor, one of the things you should ask is my sugar normal? And this is what normal should be. Right now, people will say, "Oh, I just ate a piece of cake," or Let me tell you, if you are normal, if your pancreas is functioning normally, it really doesn't matter what you eat, because your sugar in your blood should always be normal, no matter how sugary the meal you just had. So if it's ever elevated, then that's abnormal, right? So normal is 100 or less. If it's above 100, even if it's a little above 100, that's already in the abnormal range. Now, we have this thing called pre-diabetes, right? And pre-diabetes means you have impairment of the way your body digests glucose, okay? And if you're pre-diabetic, that's a problem, because just pre-diabetes is really a disease. We make it sound like it's not, but it's a disease. Right. So if you got pre-diabetes, you're on your way to becoming diabetic. And even being pre-diabetic is already negatively affecting your health. So pre-diabetes is bad. You will hear people say, "I got a little bit of the sugar." There's no little bit. It's like being a little bit pregnant, right? You got a problem, and that problem needs to be addressed. And I think we all do this as humans. We want to minimize our problems, our issues. But it's important, to be alert to the fact that you got a problem that needs to be addressed affirmatively, right? You got to move in a direction to fix this. One of my really good friends, one of my best friends, this happened to him. He went to his doctor, and his doctor told him your sugar's high, and he called me, and I told him what that meant. And to his credit, immediately he changed his diet, he changed his exercise, and he became a lot healthier. Here's the other myth: people think you can only be a diabetic if you're fat, if you're way overweight. Not true. Not true. If you're not eating a good diet on the outside, you may look like you're relatively healthy and may even be thin, but you could be developing diabetes because it's more about the number one, the diet, and number two, your movement. Right now, one of the things I want you to understand, there are two types of diabetics. So what we spend most of our time talking about is type 2 diabetes. Right? Type 1 diabetics, these are people that develop diabetes when they're kids. That's a total different disease. That has to do with your insulin not being produced by your body. That's not what we're talking about. The majority of people have type 2 diabetes. And type 2 diabetes really develops because you are either number one, gaining a lot of weight, or number two, you are not moving enough, you're not doing enough exercise, and your diet, you have an improper diet. Okay, so these are the things you need to address. If they tell you your sugar is elevated, again, the doctor's office usually will say, come back and redraw. If it's elevated, something's wrong. It should never be elevated. If it's elevated, you got a problem, and you got to realize that you need to start to do something to change the fact that it's elevated. Now, if it's highly elevated, like, if it's 126 or above, they're going to do some testing. But if you actually get that diagnosis hung on you, which is diabetes, now you've got a real problem. And I've dealt with patients that they get into denial. They want to deny that they're diabetics, right? That's dangerous, because now you're talking about things that can end your life. If you're diabetic and you're not getting treated for your diabetes, that's a real issue. Now, people will say, are there natural ways, are there natural things that I can do to reverse diabetes? And the answer is yes. But you need to first get your diabetes under control. So in other words, whatever the doctor prescribes in order for you to get treatment, you need to take that treatment while you're simultaneously changing your diet and exercising and dropping the weight. You can get rid of the diabetes if you do all those things, but you need to take the medicine, including possibly insulin, in order to get the diabetes under control. There's been a lot in the news lately about the fact that insulin therapy has become so expensive. And to me, it's atrocious that in the richest country in the world, the richest country in the history of the world, that we have a problem giving a medicine that was discovered almost 100 years ago to people. I mean, there's no reason insulin therapy should be expensive other than corporate greed. That's the only reason. It does not cost a lot of money to make insulin. That's my little soapbox for today. But the point is, if you need it, you need to get it and get it under control, and then you can deal with the more natural way of getting healthier. Next slide. Watch your blood pressure. And there's a reason why we're talking about diabetes and then high blood pressure. Once again, just to reiterate, top 3 reasons to have kidney disease. Number 1, diabetes. Number 2, high blood pressure. They're normally in a combination with one another. And then the third reason, obesity. And again, that's also in combination. In other words, the types of people that normally get kidney disease will have 1 or 2 or even 3 of these problems. All of these things in combination and separately cause damage to your kidneys. Okay. Just recently, tell you a true story. My own child, my son, who is a college soccer player, his blood pressure for his exam was a little elevated. It was still in the normal range, but it was a little elevated. And I immediately called him and I said, you have money for all kinds of other things. Go to the local CVS and buy a blood pressure cuff, and I want you to take your blood pressure every day and send it to dad, right? That was just me dealing with my son. You know, he's kind of a knucklehead, takes after his mom a little bit. But my point is, he now he went and purchased a blood pressure cuff, which, you know, you can buy them for less than $20. And you stick your arm in. I mean, it's like no thinking. You just tighten it and you press the button, and it spits out the numbers. You know, the good news about him is his blood pressure is okay. But the point is, all of us should have a blood pressure monitor, you know, particularly after a certain age. If you're over the age of 20, you should have a blood pressure monitor. There's no reason not to have one. And you just check it. And you should check it periodically. You should check it. What is my normal blood pressure in the morning? What is my pressure in the middle of the day? What is it in the evening? Because if your blood pressure is elevated, almost all of the problems that we talk about, particularly in the Black community, strokes, heart attacks, kidney disease, peripheral vascular disease, all of those things are tied into high blood pressure. That's the one thing that you can make yourself so much healthier if you just have a normal blood pressure. Okay, I've said this on this show before. When I go out, or when my team goes out into the community, and we take people's blood pressure, randomly take their blood pressure, more than 80% of the people that will have a high reading will already have a diagnosis of high blood pressure, will already be on medicine for high blood pressure, and will already have a doctor supposedly treating their high blood pressure. In other words, that doesn't matter. If your blood pressure is high, you're still at risk for all those things I mentioned. It doesn't matter if you got 3 doctors. It doesn't matter if you're taking 3 medications. If your blood pressure is still high, the problem is not being treated. So you have to be on medication that gets your blood pressure under control. And just like when we talked about diabetes, there's a lot of things you can do naturally to bring your blood pressure down. Primarily, changing your diet, number 1. Number 2, changing your activities. Something very simple. Just walking once a day. Just walking once a day, 5 times a week. You add that with a change in the diet, that will drop your blood pressure. I'm not going to say, depending on how high it is, it may not go all the way to normal, but it will drop. You will get benefits just from doing those 2 simple things. What it means to be high? A lot of people, I ask them what they think a high number is when I take their blood pressure. A lot of people don't even know what the numbers they're shooting for. You know, the number you should be shooting for on the top number, that number should be like 120 and lower, right? If that number is higher than 120, you have high blood pressure, right? And a lot of times people have numbers like 150, 160. If your numbers are constantly above 150 and 160, that's very high blood pressure. That bottom number should be below 80, right? So if that bottom number is above 80, that's high blood pressure, right? So the top one can be normal and you can still have high blood pressure. The bottom one can be normal and you can still have high blood pressure. Both of them have to be normal, okay? And if they're not, then you still have high blood pressure, and it must be addressed. High blood pressure over time is only going to lead to problems. And you see, what happens to people is that they are lulled into a false sense of thinking that they are okay because they feel fine, right? People will tell me, they'll admit, they'll say, Doc, I'm okay. Every now and again, I will get a headache. I'll eat something and I'll get a headache. What that really means is your blood pressure is always high. It's just that when it gets very high, you get a headache. Guess what happens when headaches get really bad? That's when you have a stroke. So that's a bad sign that you are walking around. You're basically a walking time bomb. It's only a matter of time before it goes so high that it went too high to cause a problem. You don't want that. You got to think, the way to think about healthcare is to try not to have a problem. What should I do to not have an issue in my healthcare life? That's the way the patient should think. Because the more you think like that, the healthier you are. Let me tell you, preventative medicine, which is why, look, I'm on the opposite side of the whole medical cycle. I'm at the end. I'm at the I do the operation and save you or you die in. You want to be at the other side. How do I not have to ever see Dr. Melancon in my career? Right? That's where you want to be, and or in my life. And that to be there, that's a lot of preventative stuff, right? You want to either never have the problem, or if it starts, you want to nip it in the bud. Next slide. Yeah, again, smoking. Smoking is bad. I don't care what you're smoking. Tobacco is bad, and any other thing that you smoke is bad. I live in Washington D.C. now. Marijuana has become, it's legal here. I feel sometimes like I get high walking on the sidewalks because I mean you can smell it all over the city. But smoking anything is bad. I remember getting in, well, I wouldn't call it an argument, but a gentleman, he was parking my car and he was talking about how marijuana comes from the ground, therefore it comes out of the earth, therefore that it means that it's good and healthy and all that kind of stuff. I said the only good greens are the greens I got. My grandmother used to cook for me when I was growing up in Louisiana. Smoking anything, I don't care how green it is, smoking is bad. Smoking tobacco is bad. Smoking marijuana is bad. Smoking what those other little gimmicky things that they have for those young kids smoking, all of that is bad. Smoking is bad. You shouldn't smoke. Period. In the story. Alcohol. Well, Jesus drank wine. Right, Dr. Calvin? No. Drinking alcohol to excess is bad. I mean, to have an occasional drink is okay. Wine with dinner. Yeah, that's all right. But drinking to the point of excess, more than one drink at a sitting, is really too much alcohol. And the issue really is the sugar. The alcohol is bad enough, but the amount of sugar that you're getting. So people having trouble losing weight. I've had patients that you go through their diary, their food diary, and you're trying to figure out where they're getting all these calories, and you realize you get a lot of calories in the stuff you drink, not alcoholic drinks as well as sodas and even diet sodas. Diet sodas are not good for you because all of these things drive insulin to increase in your blood, and when insulin increases, it causes you to hold on to fat. I tell people in trying to understand the way the body works with fat for your body is like money in the bank, right? So the way your body thinks about fat is different than the way maybe Hollywood thinks about fat, right? All of us want to have this perfectly chiseled body with the six pack and the muscles showing and all that. But that's not the way your body thinks. Your body doesn't want to look like that. Your body wants to hold on to as much fat as possible because your body is thinking that's money in the bank, right? Now you got to realize in the course of human evolution, yeah, we did evolve a little bit. I don't want to get into all that. I don't want to get in an argument with Dr. Curry, but we've been on this earth a long time, right? And in the course of all of that time that humans have been on the earth, for most of our history on the earth, we didn't have enough to eat, right? So in modern times, we have too much food. But for most of the times that mankind has been here, we've been starving. So your body is programmed to hold on to calories. And fat is a great way to store calories. So your body wants to be overweight, right? Which is why you have to work against what your body wants to naturally do, which is to hold on to all these calories. So when you give your body excess calories, it's going to hold on to them. And that's why, in a modern sense, we need to eat better and we need to move more so that we don't let the body do what it would do by its mechanisms, which is hold on to that, thinking it's doing the right thing, because the body's thinking, next week I'm going to be starving, not knowing that there's a Popeyes on every corner. Nobody's going to be starving in this country. Anyway, next slide. Exercise. Yes. Again, you don't have to do high intensity workouts to be exercising. That's a myth. You don't need all of that. All you need to do is move. And the movements can be, anything like walking, just a good brisk walk, not even a brisk walk, just a casual walk. Just go walking every day. You'd be surprised what a difference that makes if you go walking for an hour, at least 5 days a week. I've done this with a lot of my patients, and they can't believe the difference it makes. But it is huge if you turn it into a routine. Now, again, you want to stay hydrated, particularly, I mean, with global warming. I mean, I can't remember a summer that's been as hot as this one. But you lose a lot of water when you perspire, when you exercise. So you got to make sure you stay hydrated. And what you should do is you should pre-hydrate. So you should drink a lot of water before you even exercise so that you don't get behind, because you never want to get behind. But exercise is key. You got to have some sort of exercise. Next slide. Yeah. Okay. So this is one of the things, I remember we had an advertisement about this some time ago. But if you're seeing very, very foamy urine, that's a problem. Now, it's normal that the first urine of the day is going to be more concentrated. So when you first get up in the morning and you go to the restroom, it is normal that you're going to see a little bit more bubbles than if you as you urinate throughout the day. However, if you're seeing a lot of bubbles, like you can't even see down to the water level in the toilet because there's nothing but foam on top, that means that you have a lot of protein in your urine. And the reason why this is so important, today we're talking about reversing kidney disease. This is the first sign of kidney disease. Okay? So let me repeat that. This is the first sign. Before the doctors would even identify you as having kidney problems from a blood test, this can happen. And this is where you're going to find early kidney disease. We, as routine, when we go out into the public, we check their blood pressure and we check their urine for protein. Because when you have normal blood tests, but you have a lot of protein in your urine, you're at stage 1 or 2 or early stage 3 in kidney disease. And all of those stages, you can still reverse your kidney disease. So this is of the utmost importance. Now, when you go to the doctor, first of all, they should be taking a urine sample. And if they don't, you should ask. You should say, hey, aren't you going to check my urine for protein? Because they should be checking your urine for protein. That's part of a routine yearly physical. And if they're not doing this as part of your routine yearly physical, get another doctor, because they're not doing a good workup and they're not monitoring your kidneys, because you need to have this as part of your workup. And if you do have protein in your urine, because this also has happened to me or some of my patients, the doctor should address it. I've had so many patients where they will have protein in their urine, it's been detected, and the doctor will say something to the effect of, oh, it's okay. No, it's not okay. It needs to be worked up. Now, I will admit there are reasons that can be okay as to why you might have an intermittent spike in your protein. You could have had a lot of physical activity, like you just ran a race, a 5K, 10K, a marathon. That's a normal reason to get a big spike in your protein. But my point is, it should not be ignored. It should also always be worked up by a healthcare professional, because it is an early sign of kidney disease. And it's so early that the kidney disease can still be reversed. So it's something you want to be mindful of. Next slide. Yeah. So once again, I have taken care of numerous patients that are coming to me because they just never saw a healthcare professional for years. For years and years and years, they just ignored their health. You can't do that. I mean, this is the best gift that God has ever given us, are these bodies. And we're stewards of our own health. We should all expect each other to take care of this lovely gift that we have been given. And you have to go in and see a healthcare professional every year. Now, I understand that, and it's unfortunate that not everyone in this country has equal access to health care. But there are enough organizations out there that will get you a blood test, a urine test to see if you have any abnormalities. And there are different organizations all across the country, but at some point you need to go to a free clinic, or if you can't afford a physician, and make sure that someone at least monitors you once a year to determine if you have any sort of abnormalities. And the easiest thing to do, like I said, is just a blood test and a urine test. And that's one of the best ways that you can identify early kidney problems. And if you identify kidney problems, you really could be identifying a lot of stuff that can impact your health negatively. We started the conversation by talking about an abnormal glucose level, right? Well, diabetes is a gateway. They talk about gateway drugs, where it's a gateway problem that leads to a lot of different things: vascular disease, cardiovascular disease, peripheral vascular disease, kidney disease, liver disease. So you want to find that out. You want to find out if your blood pressure is abnormal. Finding out you have abnormal blood pressure, if you have a good workup, you can find a lot of problems. I talked to a young lady today who, it was an increase in her blood pressure that caused her to have a whole workup, and a mass was found on her kidney. And thank goodness it was caught early. But my point is, just normal screening, the great thing about normal screening is it can catch other things. And a lot of things are totally different if they're caught early versus later in their course, particularly cancer. There are so many cancers that we can totally, completely treat to cure if caught early, and can kill you if caught late, right? So screening is of the utmost importance. There's nothing you can get in healthcare that saves more lives than screening. Next slide. Well, okay, so we're at the point of questions, and I'm glad we left a lot of time, because hopefully there are lots of questions out there. I didn't want to drill down into too many details, but I just wanted the people out there throughout the country to understand you've got to be, number one, proactive about your health care. Number two, realize that your diet is a big part of your health. Number three, exercise is a big part of your health. And these things have to be caught early, and you can't ignore little blips like, oh, your blood sugar is a little high, your blood pressure is a little bit high. It has to be addressed. It has to be addressed in a very aggressive manner, or it can lead to problems.
Well, we thank Dr. Melancon for some great information, and as you notice, he can talk, and he's not a shy person. But we want to begin with some of these questions, because there's a lot of dialogue going on in the chat, and I think it's relevant. I want to go back to the beginning part of your presentation and talk about just this whole idea of water. You know, you've said that water is very good. It's the greatest thing, one of the greatest things that we can have, that God has created. But there was a note earlier that said, should some people watch their water intake with medication, because water can wash out their meds? Is there any
Yeah,
comment with regard to that?
yeah, no, I get it. But honestly, unless you're really drinking way too much water, and you should drink about 8 glasses of water a day, 8 normal glasses of water a day. But most medications, drinking water with your medicines is good. So, like I said, unless you're being going overboard, drinking water will not wash out your medications to any degree. So, no, I don't agree that that's a real issue, because you would have to drink gallons and gallons of water for it to be a problem when taking your medicines. Like I said, water takes up space in your stomach, which is good, because like we tend to overeat in this country, in the Western world, and the fact that the water changes the dynamics of the stomach is good in restricting the diet. But for your medicines, usually drinking water is gonna help. So no, you can't drink too much water with your medications.
Any comment there, Dr. Calendar?
My only comment is that I agree with Dr. Melancon 100%. But there's one thing he said during his presentation that struck me as interesting, and that is that he suggested, and maybe Dr. Melancon, you can uh, correct me if I'm wrong, but you said that you can have urine protein in your urine and still have normal blood work, uh, meaning that if the doctor doesn't check your protein, he will miss the earliest sign of kidney disease. And he will get your blood test, have a normal BUN, normal creatinine, and think that you have a normal kidney function. Is that what you're saying, Dr. Melanson?
Yes, yes, Dr. Calvin, and thanks for that question. And I know you know the answer, which is you are absolutely correct. And that's the issue, right? So stage one, stage two, kidney disease, you get a blood test, everything looks good. I'm good. My kidney function's normal. My creatinine is normal. And normal, yes, that is okay. But if you've got protein in your urine, that is the earliest sign of kidney disease. And that's why that's a big part of what we do when we go out into the community, because oftentimes people don't know, and they're lulled into this false complacency thinking that their kidneys are okay. I'm gonna tell you one thing further, Dr. Calendar, and I know you know this as well. What I always tell my patients, not only should you, when you get the printout, right? You get a printout usually of all your labs. Or now you can go most hospitals, you can go into the computer and you can see all your labs. What you really should do is not just look at your most recent lab results. You should pull up your most recent lab results and compare them to the prior year, because you can still be in the normal range, but your numbers moved between year one and year two. Like Dr. Calendar was talking about creatinine, which is how your GFR, which is called the glomerular filtration rate, it tells you how good your kidneys are filtering. That number, for a normal person should be around 0.9. Okay, so that's a good number, 0.9. For a person my size, I'm almost 200 pounds. So I can have a creatinine of 1.2, and I'm still in the normal range. But if I last year my creatinine was 0.9, and this year when I go it's 1.2, there's not going to be an alarm that goes off. The doctor may not tell me anything's wrong. But if I notice when I look at my labs that I went from zero point 0.9 to 1.2, I should call the doctor back and say, hey, what's going on? And that should be addressed, right? And that's why you need to be your own healthcare advocate. You need to be looking at all these things, not saying, so many patients, they come into my office and say, oh, the doctor hasn't told me anything. I think everything's fine. No, you need to know everything is fine. You need to be checking, right? You need to be one of those patients that sometimes irritates us. They ask so many questions. I have patients like that. They come in and everything's written out. They got like 20 questions, right?
Absolutely.
And they're kind of irritating. But you know what? Those are the best patients because they get the best care, because they're pushing us to give them good care, right? You got patients like that, Dr. Calendar, right? They got a bunch of questions. Yeah, but that's what you want. You want patients like that, because those irritating patients are getting the best health care. I promise you. And that's what I tell. When for my family members, when they're going to see their doctors, that's what I tell them. I was like, ask them this and ask them that and ask them this. Yeah, because you want to ask a lot of questions. You want to be one of those types of patients that's well educated when you go to the doctor.
So, Dr. Melanson, we want to get to some of these questions that we have, and this is just an amazing piece. I think one statement that you just made, it refers to being your own self advocate and your own having some self agency. I want to go back up into some of these questions and comments that folk are making, and I want to start with one that was earlier, and they said, I have a cyst on my kidneys and it hurts off and on. Am I in danger of more problems?
That's
Any
a great
brief
question.
answer you can give?
Yeah, that's a great question. Well, first I'll give you the good news. Usually a cyst on the kidney is not that big of a deal. So having a cyst is not really an issue. Oftentimes, if you just find a benign cyst on the kidney. Now, what's unusual is she said she's having pain. Now, just having a little cyst on the kidney does not normally give pain. So when
Right.
if I was just listening to that story, like if that was a question on a test, I would say this person might have what's called a variant of multicystic disease,
Yeah.
right? Which again may not be a huge problem, but she should have a workup, right? And they're different. You know, you can get an ultrasound, a CT scan, but if you're having pain from a cyst, then that means either the cyst has gotten infected, or maybe you bled into the cyst. You know, these things can really be very quickly diagnosed with the right sort of imaging. So that's what I would say, because it's not normal. It's normal to have cysts. It's not normal to have pain because of the cyst. Or you could have a cyst, but the pain's coming from something else, right?
Sure.
So this needs to be worked up by a healthcare professional, because it's not normal to have pain associated with a kidney cyst.
Well, I want to clarify something, and I'm glad you did. You referred to this cyst, and it could be polycystic and all of those sorts of things. When you're looking at the protein in urine, and you see you're looking for a frothy or a foamy urine, um, isn't it normal that when urination happens, that there are some bubbles that are at the surface once you urinate?
Oh yeah,
And then,
absolutely. Oh yeah, there is a normal, like I said, there's a normal amount of bubbles that we all see in our urine, and there's a normal amount of protein that will pass through the urine. So yes, that is normal. What I'm talking about is, I mean, we've been making urine all our lives. If all of a
absolutely.
sudden you start to see lots of bubbles where it's almost coming to the top of the toilet, that's when you should say, wow, this is abnormal amount
Something's wrong.
of bubbles. That's when you have a lot of protein. And like I said, even in the morning, it's normal that first urine of the day is going to be the most concentrated urine you make, because you've been sleeping all night, and everything's been sitting there becoming more concentrated. So that is normal to have a little bit more bubbles in the morning. But what I'm talking about, it should be obvious to most people, because
Sure.
they should make a mental note. This is more than I've seen all my life. That's when you got a lot of protein.
Yeah, I want to get through these questions. There's a lot of dialogue going on in the chat. One person said, Michael said that fasting is a great way of healing the body along with prayer. Is there a role for fasting in terms of reversing kidney disease?
Yeah, now that's a great question. And so many of these fad diets, they can get you in trouble because the things can be controversial. But let me start with the obvious, which is he's absolutely right about prayer. So prayer is important. Dr. Callender has talked about for years how that is a part of what makes people healthy, beyond God doing what God does. But I'm just saying, just from a mental piece of being a God-fearing person, it makes you healthier. And then studies have been done on people that pray and people that don't. And the people that pray and go to church regularly do better. So there's no doubt that prayer definitely helps. Now, as far as fasting, of course, throughout history, people have always fasted, and fasting is a good way to have good health, primarily because it causes you to decrease your caloric intake. Right. So decreasing the caloric intake, no matter how you do it, is going to be good. And I think that intermittent fasting or incorporating fasting into your lifestyle, those are good things, because, again, we eat way too much. Right? We don't have a problem with getting enough calories. Now, you've heard of these things called food deserts and things of that nature. That's not about people eating or not eating. I'm talking about in this country. Now, there are places in the world where people don't get enough to eat. In this country, it's eating the wrong things, right? So you're eating too much junk, too many preservatives, and those things will drive a lot of the problems that we see, like high blood pressure and diabetes. But
Sure.
fasting, I have no problem with fasting. I think that decreasing your caloric intake makes sense because we have the opposite problem in this country.
Well, as a man of faith, unapologetically Christian, I highly recommend that some things only come out by prayer and fasting. So I think Dr. Calendar, you would say amen if you could. Um, but I do want to ask, Dr. Calendar, there are some that may have a low A1C if they have sickle cell trait. Can you speak to that?
Well, I think that most people aren't aware of the fact that sickle cell trait uh, it is not really as desirable to get a hemoglobin A1C because you need to have different measurement for sickle cell disease. And for example, one of my best friends and one of my mentors has sickle cell, and I made a mistake and asked him about was hemoglobin A1C, and he quickly reminded me that as a sickle cell patient, the way to monitor is not hemoglobin A1C because sickling is a different process, and as a consequence, that's not what you use to follow those. But he happens to be a diabetic and a sickle cell patient, so he has to address both issues. But that's the one situation where the hemoglobin A1C would not be the best way to monitor.
Well,
Well, I think
I thank you for that. And I just wanted to ask another question, Dr. Melanson. We got a question from Leroy that says, is it okay for older people to have a little elevated, and I'm thinking elevated sugar level to fight Alzheimer's?
That's a good one because he got me on that one. I had not heard that, but the answer is no. So and here's the thing about all sorts of dementia. And again, you got to remember, I'm from the deep south, so I know what I'm talking about. Vascular disease goes hand in hand with dementia. So anything that increases your vascular disease is going to increase your incidence of dementia. So it's actually the opposite, right? So what he's asking of having a high glucose, no, no, no. High glucose is, first of all, it's poisonous. So you got to understand the way our bodies are made is glucose is great. It keeps our cells alive as long as it's in the right compartments. And when you're eating too much glucose, it starts to get out of the right compartments, right? And then when it gets outside of those compartments, it's actually toxic to your cells. That's why diabetics wind up with amputations. And if you ever feel the skin of somebody that's been a really bad diabetic for a long time, their skin doesn't even feel normal. It feels tough, right? That's because the sugar in and of itself getting out into your tissues is toxic to the tissues. So just like it's toxic to the tissues in your skin, it's toxic to the tissues inside your brain. So that is definitely not true, Leroy. High sugar is bad for the brain, it's bad for the vessels, and you should never want your sugar to be high, even as you get older. It's just the opposite. You want your sugar to be under very good control, and you want to decrease the things that can cause vascular disease. Like if you're a smoker, you want to stop smoking. If you have diabetes, you want your diabetes to be under control. If you have high blood pressure, you want your high blood pressure to be under control. Because we don't know what are good treatments for Alzheimer's yet, but all dementia is going to be decreased in populations that have less vascular disease. So as you look out around the world, when people talk about the great diets like the Mediterranean diets, one of the things they're talking about is people that eat those diets are healthier, including mental health. There's less dementia in places where people have good vascular health. You're I can't hear you, Reverend Curry. You must be on mute.
There's a question and comment around blood in the urine. Is blood in the urine a sign of kidney disease of any sort?
Well, blood in the
Dr.
urine is
Calendar,
abnormal.
Dr. Lawson?
Yeah. So blood in the urine is abnormal and
Yeah.
it needs to be addressed because even micro, like usually when you see blood in the urine, it's going to be what's called microhematuria,
Yeah.
right? Not microscopic hematuria. So you don't even see it. It might show up in your urinalysis that the doctor will tell you have blood in your urine. Now, if you have enough blood to see to your urine to turn red, that's macroscopic hematuria. That's particularly vexing. So, but blood in the urine is never normal. It must be worked up. It could be a sign of kidney disease. It could be a sign of disease anywhere in the urogenital tract. So blood in the urine is bad. You got to get it. You got to go see a doctor. It needs to be worked up. It can be a sign of a lot of different things, from a kidney stone to cancer in the bladder, in the kidney. But blood, full stop. You need to get it worked up. That's bad. It's never okay. It's never normal. You got to get it worked up.
Well, this is some major information that's going on in the chat. We really only have a few minutes, but I want to do sort of a lightning round, if you will, Dr. Melancon. I know that's hard for you, but a lightning round between you and Dr. Calendar to really help us come down with some of this, because we have some outstanding things going on in the chat. I want to talk about just briefly, should we eat smaller meals instead of maybe the normal 3 meals a day? Should we eat smaller meals and eat 4 or 5 a day?
Yeah, I've seen a lot of people recommend this, and I think that's fine. I again, it's about how many calories you take in a day. So
Okay.
if you eat a lot of small meals, it may help you stay satiated. It may make you eat less at a sitting. So I think that's perfectly fine. I think so much of what happens in our culture here in the United States is about gluttony. I mean,
Sure.
you see these advertisements for the. I mean, to me, it's just
Yeah,
like
it's a
it's
lot.
crazy. You get a burger with it's like the burger plus bacon plus a piece of chicken
Well,
plus
it's
a
two or
ham
three
hock. I
burgers
mean,
on a
it's
burger.
crazy.
Yeah. So let me ask this quickly. We want to do these quickly as possible, try to get a few more in. You know, we talk a lot about salt and its correlation to blood pressure. Are there any sort of additives that we can use? Added is wrong word. Should we try garlic salt or garlic instead of salt?
Yeah, I think that anything that has salt in it, you should avoid. So anything, if the last word is salt, you should throw it away. But garlic is good. So any of like there's a lot of flavorings. For matter of fact, I'm African American, you are too, and in so many of our culture, different because there's different cultures. Like if you're from Texas versus a better state like Louisiana versus some other part, we all have these little micro cultures. But the point is, seasoning is good if you take out the salt. So black pepper, red flakes. I mean, almost any type of seasoning other than sodium chloride or anything that has sodium chloride in it is actually good and healthy for you. So I'm a big fan of seasoning, being from South Louisiana. But salt is the one thing we need to take out.
All right. There's a lot in here. Chloe Gould really talks about, and you're in our thoughts and prayers, of course. She was diagnosed at 21 and she was already at stage 3. But she talks about in the chat literally how healthy she is and how important it is to talk to doctors. And so as we get ready to think about, closing out, what can we do to get more folk to challenge their primary care physician and be great patient advocates so that we won't have these debilitating diseases in our communities? Dr. Calendar?
I think you hit the nail on the head there, Dr. Curry, because that's what we're all about. That's why we have screening. Everybody doesn't do screening, and when I say screening, do urine screening, because they may do blood pressure and BMI and not do urine screening. So I think one of the first starts is to have everybody do urine screenings. And the point you made about if your doctor doesn't do a urine screen, advise them to do so or change your doctor is excellent advice.
Yeah, I would agree with what Dr. Calvin just said, because you know, you only can learn if you push, right? And I think oftentimes patients are just passive when they go to the doctor. And you need to be the opposite of passive. Ask questions. You should want to know any medicine you're being prescribed, anything that's going on with your health. I mean, there's nothing that's more valuable to us than our bodies.
That's
People will
exactly
worry more about what goes into their car than what goes into their bodies. This is, I mean, you're a man of God, Dr. Curry, and God gave us these bodies, and we must take care of them. So you should know any medicine you're taking. Oh, here's the other one. Oh, I'm glad I thought about this. People think that if they're taking something that's herbal, that somehow it means it's magically healthy. No, no, no. Anything you put into your body can have a side effect, right? So if it comes from the health food store, if it's herbal, if it's whatever, you need to understand. Do some research. The thing about research now, with the computer, you can find out anything. Research everything. But yes, challenge the doctors, ask questions. You need to be proactive about your health care.
Well, yeah, and I know we're over, but I did want to say this because this is very important. A couple of things. One, I stand corrected. The question as it related to Alzheimer's was, is low blood pressure associated with Alzheimer's? That was a question there. And you may want to comment on that, either Dr. Melancon or Dr. Calendar. But there's this one that says salt is not the problem, sugar is. So should we be looking at both sugar and salt
Yes,
in terms of our consumption?
absolutely. And that,
Yeah.
that caller is correct.
Yeah.
But salt and sugar, or they're the twin terrors. So they're both a problem. So
Say that again. They're twin what?
the twin terrors.
All right.
Salt and sugar. They go one and the same, because the obesity problem, you can trace it to too much sugar, and the blood pressure issue you can trace to too much salt. But even sugar can actually increase your blood pressure. So both of them are equally bad. And she's right. We need to be decreasing both in our diets. The question about low blood pressure. Well, that is interesting, because yes, low blood pressure can be a problem primarily if you already have vascular disease. So, we see this, Dr. Calendar knows, in patients that have kidney failure, they will have had high blood pressure for years, and then they have low blood pressure, right?
Yeah.
Because you wind up getting a lot of vascular disease from the high blood pressure, and then because you have vascular disease, it's affecting your heart. So low blood pressure as you get older can be a problem, only because you had years of vascular disease, and then that's robbing the blood going to your brain. So that can be a little bit of a dicey issue as you get older. But the main thing is to avoid getting vascular disease.
Well, I want to thank you so very much, and we've learned so much. If we just look at the comments alone, we have an opportunity for multiple webinars, and I'm grateful for all of our audience being here on Kidney Talks with the Ron and Joy Paul Kidney Center at the George Washington University. And I am Kendrick Curry, along with Dr. Joseph Keith Melancon and Clive Callender. I'm Kendrick as a pastor of Pennsylvania Avenue Baptist Church. Dr. Callender with the Minority Organ Tissue and Transplant Education Program. And of course, Dr. Keith Melancon, who is the leading surgeon, I would say, one in the country at the Ron and Joy Paul Kidney Center. Thank you so very much. And this has been some great information. And I look forward to having another great time with Kidney Talks. Thank you so much, and have the best day in the world. God bless you. Bye-bye for now.